to start about your ankle. So I'm going to talk a little bit about what's going on and what the presentational symptoms that you're showing up with. You have sustained an ankle sprain injury and overstretched some of your ligaments in that ankle. Think of your ligaments as the long enforcers, and the ligaments connect two bones together, especially at the joint, and they prevent overly twisting or overstretching of the ligaments. And what happened when you were playing tennis with your friend, because you landed on the outside of your ankle, those ligaments overstretched, and the long forces were not happy with what happened. They, right now, because you're showing up with the early phase of healing, which some of the symptoms are like the redness that you're experiencing, increased swelling, some of the heat and the pain. While these symptoms are not very pleasant, they're really good signs. This early phase of healing, it happens immediately after the injury and all the way to 5 days during the early window. So the line forces have called for backup. And there's all these cells that come to the area which are doing the job. So these symptoms, that makes that the cells are doing their job with all the swelling, the inflammation, the redness, and the pain. In this early phase, it's really important that you embrace the acronym PRICE, which you've already been doing. P, by protecting your ankle. By using the crutches, you're not putting any load on that ankle. Resting it, again, because you're not able to walk, you're actually resting that ankle joint. You're gonna ice. We'll talk a little bit more about the cryotherapy modality during our session. Compressing and elevation, so they're gonna be really important components in this early phase of healing. The second phase is a little overlap on the first phase, and that can last from 48 hours to 2 to 3 weeks. I know it's a very big window, but in that second phase, depending on the cells that are coming to the area and doing the job, not only are they cleaning some of the repairable tissue, but they're helping build new tissue. And that's why it's a little bit of a bigger window. The tissue is still very fragile, so it's important together in PT, depending on the exercises and some of the modalities we're implementing, will continue to the healing process. The third phase can be the most challenging because that lasts longest. It can be anywhere from 6 months to up to a year. And in that phase, it's very tempting to get back to exercise or back to sport rather. And sometimes it's too early too soon. So we'll work together on making sure that we get that proper amount of loading because the tissue is still being built. The new tissue is still not to the strongest point, but we'll make sure that we do the right amount of exercises to help with that healing process.